by David Rumelhart after other people had.
Good evening, all.
Good evening, Deepak.
Good evening, sir. How are you?
All good, Deepak.
Yes. Last two classes assignment. Tomorrow I'm going to put. It's a very small assignments regarding clinical documentation. This week you can submit it through the email. Any doubts regarding previous classes? Dr. Prabhakar, Dr. Minas, Dr. Ria, you can unmute and please let me know.
Yeah, sir, we'll go through again and then we'll get back to you if any.
Okay, no
Thank you,
problem.
sir.
Anybody has any, if you are any feeling any difficulty to follow, because what are the previous speakers, yes, they are experienced. They are very good in that domain. So with that only I have given the topic to the assigned speakers. Otherwise, I will conduct myself if I don't find. So I need your feedbacks of speakers, like if anything you are not following and all, because we need a critical feedbacks to improve ourselves. That is very, very important. And always watch the videos and make it start. I think all of you know how you can make it start in your WhatsApp. I need not have to tell you. Otherwise, copy and paste. So I'm getting good feedbacks from all experienced pediatrician. That's good sign. See, probably this week is a very important week for of your course, because this is where you are going to learn the very integral part of the clinical decision supporting system, especially solving the complex cases in our day-to-day activity, especially if you are really taking a admitting a case and evaluating a case. If you are in a doubt of diagnosing, and if you have a doubt how you are not going to follow this case, what will be the next type of management, how to get the differential, how is your how to orchestrate the next management level. All those things is this week's class. Okay, this and next Sunday. And in this academy, we are going to show you some demonstration of. So today I will show you the demonstration of how this general LLMs can be used to analyze the complex thing, step-by-step approach. That's the one thing today's class, 1.5 to 2 hours. And in next Sunday, we'll have some practical demos from the vendors. Okay. From Eka Care, from HealthRay. These are all AI-enabled software. If possible, the traditional software also we are going to show you. Then I'm going to show you the newer software from the pediatrician for the pediatrician. Of course, it is in a alpha or beta version that you have to remember. As a AI-enabled pediatrician, now you have a little bit of basic foundation idea of AI. You can use it for a complex cases. Last Sunday, I was in Vadodara. All of you listen to my YouTube video link that I have sent in the general group. If anybody is not watched, you tell me, I'm going to send it. It was one of the best 1 hour of my spontaneous presentation of intelligence in pediatric AI ecosystem. If anybody has watched that link, YouTube link on intelligent AI ecosystem. Okay, Pratima is not, but link is there in the open group. But was that talks between, I think 5 speakers, we have given a lot of talk about AI. It could be a revision for you because some things are repeated. But what I have spoken is not yet spoken to you. That is very, very important. So it is a more of how the intelligence works in a pediatrician's office. Okay. It is not about the only our intelligence. It is the parents' intelligence, is our staff intelligence. Okay. And after the visit, how this intelligence will continue to work with the patients as your avatar to various agents. So I've given a spontaneous talk with a little bit of slides, okay, that I have prepared for that. I can share you the link of the slides also. It is in the Gamma server. So please watch that. It's very, very important. Why I'm telling you this? Because once you finish this course in this, I think next month, mid-August, you people will be validating some of the AI models that we will give you to analyze complex cases. Okay. How and all we are going to train you. So that is the AI software from Vadodara, from a pediatrician called Bhavin Soni. Okay. Actually, I called him today. He is on the way to Ahmedabad, some work. Maybe next Sunday he may come online between 5 o'clock to 7 o'clock and show his software demo. So probably you are the people who are going to use this, maybe 100 cases, 50 complex cases, and you are going to give a validated report of this software, how it is behaving. See, that is what I want you people to enhance your AI knowledge. Okay. Apart from creativity, productivity, slide making, and all, this is a very, very important aspect. Okay. I think if all of you can agree, give me a thumbs up in the chat box. See, together we can build a good pediatric AI CDSS system. CDSS system is very poor now. Okay. That's good. I like your positive feedback. Any other doubts before we starting today's class? Any other doubt? Anybody? Dr. Prashant? Any difficult? I think I saw in the chat box some notebook. Yeah.
Yeah. Sir, is there any another class is going to be there on notebook LM, sir? Because I got few doubts on that. So I
You
don't
ask
want to
now
interfere
only,
in
Dr.
this.
Pratima. What doubt you have? You
Yeah.
can share your
So,
screen and show me what doubt you have. Now only I will solve. I can give
no, sir,
another 5 minutes time to you.
yeah, yes. No, sir. I did it in mobile, so that's why I can ask you, no, sir. No, I cannot
Yeah, you
share
can
the
ask.
screen, no.
Yeah.
Yeah. No. When we uploaded the source, no, sir. After uploading the source, when I want to go with the chart, no, when I ask the questions related to the source, again it's showing upload the source. It is not taking whatever I already done as a source for my sake. Again, it is asking upload the source from either browser or YouTube or whichever that column list of things is there. No, it is
Yeah,
not taking.
I got
Yeah.
your point. See, Notebook LM, once you upload the source, if it is uploaded properly and if you ask the question related to that uploaded sources, definitely it's going to answer.
No, sir.
Otherwise, it will ask you, shall I go to the web and get a fast research and deep research? If it is that
That's
is
what.
not the
Yeah.
case, please use not your mobile. Okay.
Sir.
Take your
Sir.
personal computer, either laptop or a desktop.
Okay,
Okay.
sir.
Okay, I'm going to show you live now. Okay, I'm going to share my screen.
Sir.
So what is the question you wanted to ask me? You let me know.
Sir.
1 minute.
Yeah, I'll.
Okay. Now it is called as Gemini Notebook. Okay.
Yes, sir.
Sheikh, I will come to you. 1 minute.
Yes, sir. I have the question continued to what Madam has asked.
Yeah, now only I think once she finished, you can ask me. Huh?
Yes, sir.
So now don't call it as a notebook LM, call Gemini Notebook. Okay.
Okay, sir.
So create a new. Okay.
Yeah. Yes,
What
sir. System
topic
is
you want,
coming like
madam?
this. Yeah, but in
What topic you want?
in Android mobile, yeah, this one is not okay. So,
No, you tell me the topic, madam.
Yeah. Add sources. I added pediatric toxicology one source, sir.
Okay.
Yeah, I added
So
actually.
I don't have any topic on pediatric toxicology as such. Okay.
Okay. Yes,
maybe I have one toxic case who came with. I will go to my cloud. Let me check. One. He came with poisoning with some seeds. One parent on Sunday afternoon, 2 o'clock, they bought me. I don't know whether it is not there. Okay, leave it. I'll go back to the notebook LM. Okay.
So,
See, I'm asking. I don't have any this thing. No, I'm going to the web here. Just to tell you, I'm doing a fast research. I'm asking any specific toxicology, madam, you want?
no, sir. Actually, in the drive, I got that pediatric toxicology PDF, sir.
You can
So
share
I
it in
went. To,
the. You can share that drive
that's
link to
what,
me.
sir. I'm not. Yeah. Because it is
You
in the
can put it
mobile.
in the
I
chat
mean,
box. Your drive link.
yeah, 1 minute. That's why I'm technically very, very weak, sir. That's why I'm struggling to
Unless
send it.
unless you do it day by day. See, nobody can learn in one day. Okay, it
Yeah,
will
the
take
problem
time.
is
Don't
I
worry.
can understand AI, whatever tools you are teaching, theory part I'm able to understand, but technically I'm feeling little difficulties. I have to, work it on my technical part.
Unless you practice slow by
Yeah.
slow, unless you communicate with us in a WhatsApp group day by day, small things. Don't worry. Okay, I
So,
am just showing you. Okay, here. Huh? In
uh,
this chat box, I am prompting. I need articles. Hmm? I need 10 recent articles on pediatric
toxicology.
toxicology. Common. Okay, I'm
Yes.
telling. Okay, common pediatric
Yeah.
in India. Okay.
No, sir.
Hmm?
Sir.
Approved by
Sir. IAP.
IAP.
Yes, sir.
Let me check. Okay,
Yes, sir.
what it is going to ask. You have to play around with this tool, madam. That is very, very
Okay.
important. Don't
Yes.
tell that I am very slow and all. Nobody is slow.
No,
You have to
technically.
practice. Okay, nobody can learn to drive in one day. Okay, so it is thinking now. Okay, so I have given the fast search also. Let us see. Minaj sir, you can continue with your question now.
Yeah, my question is in continuation of what Madam has asked, sir.
Yes.
That suppose I have a book,
Okay.
NRP,
Okay.
and I need a 50 or 40 slide deck for 30 minutes.
Okay.
But there's a limitation of number of slide in Gemini. Number one.
Okay.
Number two is they have their own, way of making the slides, which may not be a particular format. A
Okay.
lot of color, the colors are more, the
Okay.
dark colors. Then the font size are, less and all those things. So it may not be as professional as we need.
Okay.
So I have two questions. One is the number of slides deck, number of slides in one deck. And number two, how professional we can make it as possible as it has been there probably in Claude.
Sir, you are using
And
computer or mobile now? Minaj sir?
computer, sir. I do all
Now
these
you
things on computer.
share your screen. I will tell you. And open Gemini, Google Gemini.
Okay.
Share your slide. I will stop sharing my.
No. Problem is, sir, right now I'm in the, I do one thing. I'm in the, I'm viewing the Zoom on the computer and the mobile and doing the simultaneous on laptop, whatever do you do. So I'm not,
No,
because
that is
what I do,
better
so I come,
you try with your computer. Okay,
okay,
open the Gemini.
okay.
Okay, otherwise I will do it for you. Don't worry.
So two things, sir. Number one is the professional format, and number two
I'm
is
coming to that. I'm coming to that. That is why.
and
See,
sir,
this
one
is
more
the
thing.
Google Gemini.
The last thing is, sir, one last thing
Yeah.
is that I tried to take up this particular presentation of our Gemini Google and went to the Claude for a particular format. It could not read. So probably they have their own limitations, and the Gemini, the Claude could not read the and convert the PPT on a desired format as we ask in Claude from Gemini LLM.
See, don't put it in the Claude. See, ecosystem is Google is different. Ecosystem of Claude is different. Okay.
Uh-huh.
See,
Uh-huh.
anything related to notebook problem, no, you better ask Gemini. It will give you a proper answer. Okay. So open the Gemini, go
Yes,
to this
sir.
3.6 thinking model or pro model. Okay. You tell me the prompt now. Okay, just tell me your role. I am a
senior pediatric intensivist and a medical teacher. I
That is
need
why
to
I wanted
prepare.
to give the prompt in a voice. That is why I told you to open it. No problem, I will do.
Okay. My
I am a
apologies, sir.
senior pediatrician. Okay.
Yeah.
I have 3 doubts
Yeah.
on Gemini notebook. No, it is not notebook LM. Okay. So guys, learners, you have to go current. Okay. Gemini notebook. No, okay.
Okay.
I am a senior pediatrician. I have 3. Okay. One is number of slides. Okay.
Yes, the number of slides.
I need more than
20 slides.
10 to, okay. $50 slide per session. Okay. That is one. Second is formatting the slide. Okay.
Yes, sir. Yes,
It
sir.
is your main. Okay.
Yes, sir.
How to format slides. Okay. I think I showed you, slide with respect to color, fonts, alignment, etc. Okay. And third one
Yes,
is
sir.
What was your third one? I forgot.
I said that
Your voice is breaking, sir.
Claude does not convert the Gemini into their format. So we do not have. I mean, the Claude does not convert the Gemini slide. So we won't take up here now that.
Why Claude is not taking up your slides? I need reason. Okay. So now you give this prompt. Let's see how the Gemini is going to solve this.
Can you share
Your voice is breaking, Doctor. Your voice is breaking, Minas.
Dr. Deepak, you need to share the screen.
I don't know why. Sir, I don't know why. I'm in the mobile.
Yeah, I'm going to share.
Thank you.
See, I have put the prompt. Now I think you can see the screen. This is a Gemini.
Yes.
Okay, I'm a senior pediatrician. I have 3 doubts about Gemini notebook. One, I need more than 10 to 15 slides per session. How to format the slide with respect to color, font, alignment, etc. Why Claude is not taking up the slide? So bypassing the slide limit, notebook currently enforces hard cap 20. Okay, sir. This
Yes,
limit.
sir.
Okay.
Yes, sir.
Okay, that is the one. To build decks of 50 slides, you need to do batch generation. That I have told you already. You have to split your topic into ABCD workflow, create 10 to 20 slides for A, then B, and then you combine with regular Microsoft PowerPoint. Minat, sir.
Okay, sir.
That is
Understood.
the thing we have already told you, I think. Okay, if you are not remember, please do that.
Yes, sir. Definitely.
Your voice
Yes,
is
sir.
breaking. I don't know. There may be. Okay. So splitting the source material is very, very important. Okay. Generate the batches. Create a separate notebook LM project. Export it to PowerPoint. Okay. Then open the primary PowerPoint presentation. Insert the reuse slide. All those things you know. Regarding the formatting, the color, fonts, and alignment. Okay. I'm going to share this in the chat box. Okay. So that we can save the time. You can go through it whenever you are free. Or it is exceeded 1000 pages. I am putting the link. Share conversation. Link is copied. Yeah. You can go through it. Okay. Coming to the madam's.
Yes, sir.
Madam, already it has identified the sources. Okay.
Sir.
See all the sources it has given.
Mm-hmm.
You can import it now. See, it is importing here.
Yes, sir.
Are you following?
Yes, sir. Sir, you can't go with add sources option, sir.
You can go
You
it,
have to
but I
chat,
don't
sir?
have that. I don't have the toxicology files with me now. That's why I told you to share the PDF or the Google
Yeah,
Drive
I
link.
got it, sir. If you got the, I mean, you can do it.
If I
Okay, sir.
had
I
the
got it.
resources, I could have uploaded.
Okay, sir. Okay, sir. I got it.
Say, you
I
just
did
click
it.
on the add sources, go to the
Yeah.
drive, your Google Drive.
Yes, sir. Yeah, that only I did, sir, actually.
And you have to tell the Google Drive to share allow the other person to share the link. Okay. See, these are all my Google Drive link. Okay.
Sir.
I can upload whatever I want. Okay.
Sir. Yeah.
My drive is there. Okay. Anything which is, it has to be shared also if it is from other sources. Okay. Otherwise, download the 10-15 PDFs and upload it like this
Okay,
directly.
sir.
Download
Sir.
from the Google Drive. Okay.
Yeah.
And that you can do it. Huh? That
Sir.
is why anything you put it in the chat box in the WhatsApp group. Okay. Because this is the basic AI tool that everyone should explore. Notebook LM, after the end of this course, if you tell Notebook LM and we, the faculties, it shows that we have not taught you properly, Dr. Pratima. The onus left on us, not on you. Only thing you have to be get played around with this tool, how to upload and all. The basic thing has to be remember. See, now you have a sources. Okay. Now you can chat with this. You ask some question about toxicology.
Yeah. What is the dose of N-acetylcysteine in a paracetamol poisoning in children?
Can you able to see my screen?
Yes, sir.
Yeah. So it has taken 10 sources. See, here you have to spend lot of time. Okay.
Sir.
And you make a notes of it. I showed you. You know how to make the notes?
Yeah.
See,
Yes.
it is giving, if you click on this save notes, no, it will come here in the right side. Got it?
Okay.
That I will show you. See, it is going through. See, it has given the IV dosage. Okay, as per the which guidelines. If you click here, the guidelines will come. See? How beautiful it has given.
Yeah. That's what, sir, my doubt. For me, it didn't come like that, sir. For me, it's asking again, upload your source like that. It
That is,
asked
ma'am,
me,
it is
sir.
not taken from your Google Drive. There
Yeah,
is some
that's what.
problem with your Google Drive. Please check.
Okay, sir.
Okay, you
Okay,
have
sir.
to go to your
Okay.
Google Drive. That also I will
Okay, sir.
show you.
But it's showing in the sources
See,
already
you have to
two.
go to your Google Drive like this. I'm going to tell you. Always give, okay, whatever the content it is there. Okay, recent I'm clicking. Any drive you want to share, no, you have to give allow. Okay. If you don't allow, no, it won't go to Notebook LM, even though it is in a Google ecosystem. All these things you can ask your friends. Okay, there is some
Yeah,
asthma
that's.
is there.
Yeah.
Okay. So if you want to share it now, you have to click in this three. Okay. You click on the share button. Okay. Here you have to allow it, the other people to use it. See here it is restricted. You have to make it as anyone with a link. You got it now?
Yeah, I got it, sir. Actually, it got saved in the notebook, sir. The source was added, sir. Source got
Then you have to
added, sir.
share me that. You have to share me that.
Yeah, I'll do it, sir. Okay, sir. Let us start our class. I'll send it to you, sir, personally.
Okay, share it.
Otherwise.
Okay.
Okay, sir.
Okay, then friends, we will start with today's class. I think 26 are there. I will start. So today's class is mainly the AI in diagnosis and clinical decision support system. So what is exactly you mean by this CDSS? So CDSS का मतलब क्या है? It's a very important terminology that all of you should remember. Whenever we tell CDSS, you should think that it's a clinical diagnostic supporting system. Okay. These are the terminologies you have to must and should remember this terminologies because this is not going to change. Okay. So we will take this next 90 minutes into a discussion in a case of a differentiation between a viral exanthema versus a Kawasaki's disease. Okay. These are the some of the common clinical dilemmas we get in this monsoon season. That is why I've taken this as a reference cases. So we are going to see how this LLM is going to reason and how to audit the hallucination. Okay, that is our main scope. So in this 90 minutes, what we are going to learn today, about a 20 minutes about theory about contextual theory about what is CDSS in pediatric, what is the evidence gap, how it is going to help, how it is going to harm in the form of hallucination. We will take a case, step 2. So meet the Kawasaki disease versus viral example in a 3 years old child and build a standard prompt. How to build, even if you do not know, we'll start from ABCD. How we can use these 3 commonly used LLMs like Claude Opus 4.8, ChatGPT, Gemini with the same prompt with the same case. And we are going to see how the output varies and which LLM is good in which aspect of this clinical diagnostic system in the form of reasoning, in the form of formatting, in the form of structuring. Okay, we are going to analyze it, which LLM is good. Then comes the score reasoning. We will audit each model against the American Heart Association, Kawasaki's diseases criteria checklist. Then comes the hallucination index, tag ABCD, score frequency, all those things. Then maybe if time permits, I'm going to show you one of the so-called, I have tried so many CDSS systems, a software, electronic medical software, AI enabled with a intelligent software, built-in intelligent with it, within it. It's called Glass Health AI. That also I'm going to show you. That takes around 20 to 30 minutes. Of course, any AI talk will be ended with the security aspect, the governance aspect. Okay, as the 3 rules, as you know, all those things we are going to have it. So today's workflow will be this 7-step manner. Okay. So coming to the clinical decision supporting system, CDSS. So CDSS predates the large language models. Okay. Because it has been trained with large amount of data. The 3 very different things, we call it an artificial intelligence, how to keep them separate. Okay, there are 3 types of clinical decision supporting system that already we have used in your earlier days. I'm going to tell you what are those. I'm going to remind you and what are the things which are there in current and how best this generative LLMs you can use it as a clinical, a very experienced, talented assistant, but not boss. Okay, that you have to remember. So coming to this knowledge-based CDSS. What is this knowledge-based CDSS? So you must have heard about, do anybody having any idea about this knowledge-based CDSS? It's a rule engine. It works with this Boolean logic, if, then, or, and. It will give a lot of drug interaction alerts. It will give weight-based dosing. It has a built-in calculator. It is a deterministic, auditable, and validable. Anybody knows about this CDSS that you have used? You must have forgotten it. In the chat box, you can type. If you don't know, type it no. Don't worry. Anybody can unmute and tell me. Have you heard of Hippocrates, Medscape, Clinical AI, Clinical Key, Up to Date, Isabel?
Yes, yes.
Have you heard of all these things? What are they?
Yes. Clinical knowledge base, okay, support.
Yes, these are all handheld, mobile, traditional softwares which were there as a handheld device. So what we have to do, because this is my favorite topic in 2009, when I gave a presentation of 1 hour on this, what are the mobile phone applications for the doctors, especially pediatrician, that you can use. These are all the tools I was telling in 2009, I'm telling you. That was my first talk in a pedicon, in the National Pedicon in Hyderabad. So these are all traditional software which are meant to do specific duties, knowledge-based CDSS. Okay. So I'm going to have this digital application separate as a free webinar update. It doesn't come under AI in our regular monthly updates. If at all, if you want to know, put it in the chat box. I want to know. Okay, IWK. To type IWK in the chat box. Okay. I am going to conduct you separate non-AI based digital apps that you can use it in your Android phone, your Apple phone. Okay, which are all the best, which are all free, which are all paid. Okay. We have a beautiful IAP CMIC का एक module है called Smart Medicine or Smart Clinic. In that we have a separate session on this digital apps. Okay. So if at all you want, I will take a dedicated class on this apps. Okay. Digital apps. So this is a knowledge based CDSS. Okay. So what is ML based CDSS? So machine learning based CDSS is nothing but these are all in the pipeline, and in US they are already Massachusetts University, the Glasgow, they are all released their own models, ML based CDSS. इसमें क्या होता है? They use this machine learning में deep learning model they will use to recognize the pattern, especially the clinical use cases in sepsis flagging. Say for example, you have a 35 cases of pediatric sepsis or neonatal sepsis in your ward. Okay, you don't know how to predict the sepsis score, how the sepsis is there in your premature babies or in dengue fever. You know, in dengue fever in prematures, you are not going to load with many antibiotics. Depending on your community culture report, you are going to have probably a prophylactic antibiotic coverage. On top of it, once you train this model with the sepsis score system, it is going to flag you 1 to 2 hours before a human being with some criteria. Okay. There it will tell you, it will flag you, Dr. Deepak, see the bed number 6, the vital monitors are going, there is a heart rate variability is there. So this child may go for severe sepsis, be alert, send blood culture for culture sensitivity, blood for culture sensitivity, start an IR antibiotic, depending on your knowledge, your previous culture sensitivity report. See, that is what the flagging of sepsis. I think all of you got my point. So how these ML models are used in your ICUs. Similarly, you have a prediction model for if you are a neurologist. I think Dr. Vaikunth Raju sir is also in the bear. He's a very famous neurologist, one of the very few first neurologist, DM neurologist from All India Institute of Medical Sciences. I don't know whether he is there or not. If he is there, tell me. The prediction of strokes. You know, nowadays we are getting lot of pediatric hypertension patients in less than 12 years. Yes or no? Because of our non-dietary good habits, we are getting pediatric hypertensions very early, unrecognized UTI followed by renal hypertension. Because of pre-obesity and obesity, we are getting hypertension. So the risk of stroke is very, very early in terms of hemorrhage, ischemia, or various causes. So the prediction of stroke will be early if that model has been trained with this machine learning method, okay, with various values in terms of the intracerebral pressure, CT scan pictures, or your ultrasound. Yes, anybody? Any doubt? So ML based CDSS means that we commonly use in pediatrics are these two, sepsis and stroke prediction model. Okay. The third one, commonest ML based CDSS is your Apple Watch or fitness watches. You must have seen in the media, in the newspapers, these Apple Watches are flogging the atrial fibrillation earlier than the symptoms comes. In yesterday's, last Sunday's AA conclave, Dr. Satish Pandya was telling about, he was our previous batch learner. He's a senior pediatrician. We are in a APCMIC group. He is from Vadodara. He was telling the parents are in India, aged patient, and their children are in US. They have gifted their parents the Apple Watch and they have asked them to wear it daily. So whatever the recordings which were there in the Apple Watch from the parents, their kith and kins in the US, they saw the report and they say there is some variation in heart rate and it has flagged that they have to consult a cardiologist immediately. They called their parents from US, Papa, Mama, your heart rate is getting variation. It is flagging some signs, source of some ischemia. You immediately, whether you have symptoms or not, you go to the cardiologist and take your opinion. Then they went to cardiologist. He did a ECG, echo, then did a the coronary vascular study. Then they found out they had a block. See how technology is transforming. For example, if they have not used this fitness watches to flag it, and the communication internet was not so fast to communicate with their children who are in US, what could have been the consequences of their parents who are there alone in the India? So did you like this? The use of technology? You put a thumbs up in the chat box or in the reaction you can put a thumbs up. See, that is the power of using the technology. Okay, that's a responsible AI. Then comes the generative large language models. So today we are going to see, as you know, the fundamentals of large language models. These are all probabilistic language models. Okay. They will take your prompt as a segmented tokens. Then it will go to embeddings in the vector database. Then in the attention mechanism, in the self-attention mechanism, it is going to comprehend and give you the output. So it could be probability. Okay. It is not 100%. Okay. So whatever the output the generative LLM is giving with a vast amount of data, you have to take it as a pinch of salt and you have to analyze yourself. Okay. So the critical point what I wanted to highlight is general LLM is not a complete clinical diagnostic system. There is no regulatory clearance, no validation on your open population. There is no accountability layer. It is a reasoning aid. Okay, that you have to remember. But how you can make it effectively, it is in your hand. That we are going to show you today. Hope I think you cleared this knowledge-based CDSS, machine learning-based CDSS, generative LLM CDSS that we are going to have a demo. Okay. Any doubt till now? I'm going very, very slow by slow. Everything is clear, Dr. Pratima, Dr. Sham.
No.
Yes, sir. We
Very
are
good.
with you, sir. Yeah.
Okay. So now we go to the pediatric evidence gap. I think this is a repetition of my free AI update hour in the last month. You know, out of thousands of FDA cleared AI models in US, okay, Food and Drug Administrative, the government regulated policy company which has approved more than 1,000 models in the medical, in that only 4.4% are pediatric age ranges as per the 2026 cross-sectional observation. These have been given the clearance. Okay, 149 pediatric label AI devices are there for still in the screening phase, not in the diagnosis phase. In the screening phase, not yet completely cleared the FDA, but they have given a just a approval to use it as a screening agent. Okay. So children are not small adults. Okay, that you have to remember. You should have a weight-based physiology. You have a age-dependent normal ranges. There is a developmental variation, and we are having a lot more number of rare diseases density. I think the slide here, it is, I just make it top. Okay. So rare disease density. See, these are all the 4 important aspects which differentiate from adult that you should know. And every AI diagnostic suggestion, the pediatrics has little bit of inheritations of adult data bias that you should know. That is why whenever you give a prompt, always tell that LLMs that I am a pediatrician and I need only pediatric studies. Okay. If you don't have a pediatric results, you please let me know. Okay. Don't hallucinate. That is the prompt you have to always give it to the LLMs. Okay. That you have to very, very important whenever you give to analyze any complex cases that you find out. Don't put it about the simple cases. Please don't use all these LLMs for your simple pneumonia, simple respiratory, simple gastroenteritis. Okay, use it for complicated like Dr. Pratima told toxicology case where you do not come across very frequently. Okay, complex cases like Kawasaki diseases, complex cases like dengue shock syndrome, which is not responding, or any second opinion cases who come with lot of files of CT scan report, MRI scan report, ECGs, okay, inborn error of metabolism reports. You put it all into that and give ChatGPT after taking out the names and all. You tell ChatGPT, summarize the reports and give me the results. It will do it very fast. So LLMs are trained overwhelmingly in adult skewed literature. Okay, they default into adult frame unless you force pediatric context, flag it, correct it, override it. Kawasaki disease is a perfect test. That is why I've taken it for this today's thing. Hope I think you are following this. I will go to the next slide. This is a very important slide that I wanted to highlight. Where the AI is going to help, where it is not going to help, or it is a disadvantages. Okay. So AI is genuinely helps to broaden your differential diagnosis whenever you have a very complex cases or any simple case with complications where you are in a dilemma, where you want to dig more in a short time, then this AI is going to give you the differential step by step. Okay, step by step. Okay, and structuring the workup or a checklist. You have lots of investigations, serial CBCs, serial platelets count, serial peripheral smear, lots of intervention. All these things date-wise you upload it to the LLMs. It is going to give you a proper workup list in a structured way. And you can ask a follow-up prompt. I need a follow-up investigation protocol, follow-up management protocol. It is going to give you. Then you have to download it. You have to go through it step by step. Then you have to take a decision. Okay, because you are the boss, not the AI. Then explain the condition in a parents. For example, you have a PICU case of a complicated shock syndrome, whether it could be a dengue or any other viral myocarditis with shock syndrome. You want to explain in a patient language. So you tell the ChatGPT, I think Dr. Harsh and Dr. Prashant have given you how to communicate in the last class. I think Dr. Samir, in the patient's plain language, in your own vernacular language, whether it is a Tamil, whether it is a Kannada, whether it is a Gujarati, whether it is Hindi, you can talk to the LLM. I have a dengue fever cases. His condition is now like this. I want to counsel the patient. So you can take a audio output. You can take a script, put it in the notebook LM. You can make it as an audio podcast. You can make it as a video podcast, and you can give it to the patients with the time and the date. That is very, very important. And store it. That is very, very important. And if you can take a printout and you can take a sign in front of a video enabled CC camera, that will be also safeguard you for medical legal purposes. So technology integration is very, very important. Then comes the literature triage and synthesis. Say, for example, you don't have access to any WhatsApp group of your friends. You put it in a community. I have a complicated case of dengue with the shock. He is not responding for IV fluids. Okay, not for your plasma expanders or volume expanders. Not responding for your inotropic. Not responding for your blood transfusion. What to do? The people are not responding because they are busy. Then you can go for literature triages. So how to do literature triage synthesis using this common LLMs, I'm going to show you today. So this will give you the ground truth of literature. Okay, just now in notebook LM, when I didn't have a toxicology papers, I went to fast search, asked Google to search it. It has given along with the references. You have to see the references and you have to decide. Okay, that is very, very important. Just because it has given a reference, don't believe that reference may be a hallucination or it may be factious. You have to go through each and every step, then you have to take a decision. Then comes the second look of documents gaps. For example, your patient is admitted for 10 to 15 days. It has been treated well. It has been shifted to the step down. Again, it is shifted to the ward and it is about to discharge. You put it all the documents after de-anonymizing or de-identification, the protected health information, and make the LLM tell him to make a proper discharge summary document step by step. And it should be as per the regulatory rules of your country. Like if you are in a UK, it should be GDPR. If you are in US, it should be HIPAA complaint. If you are in India, it is DPDP Act 2023. So it will go through the web and it will make each and everything step by step. Then it will tell you, please go through once again. Then you can share with your patient in terms of a hard copy or a share. So this is how the AI is going to genuinely help in the field of CDSS. Okay, that you have to remember. Don't worry, I'm going to share these slides to you in the WhatsApp group after this talk. Please utilize, you go through it. and also the recordings I'm going to give you. Where A is dangerous or weak are going to hallucinate. So false confidence with rare pediatric conditions. So here in rare pediatric condition, never use this general LLMs. If at all you want to use general LLMs, you go to the perplexity, choose academics that I'm going to show you, choose deep search, then you take the rare pediatric condition, ask for 10 to 15 citations with the reference, go through that, then you can use. Otherwise, I will show you one more dedicated LLM for this called Consensus AI that I'm going to show you. Then comes the hallucinated citations and doses and guidelines. So all the citations which are there are fabricated, which is not at all there. So please don't take that LLM further. And wrong doses, wrong guidelines from it is not at all there in IAP or AAP. So all these things you should see. Cross verification is very, very important. Okay. That is why whenever you start using any LLMs beginning, you have to go through rigorous. Otherwise, you ask us who are doing this since long, we are going to tell use this LLM for this purpose, use this LLM. That will save your time. That is why after this course also, my humble request, do not leave the group. You be with the group. Every updates we are going to them, every doubts, queries you have, we are going to help you to use this AI tools in effective way. Okay. Don't leave from the group just because of small difference between any one of us, because we are all human beings. You maybe get bored, but never leave, because being here is to gain the knowledge, not to lose the knowledge. Okay. But living here from the group is definitely, it is lost for anybody. Okay. That you have to take. And of course, any identifiable patient data, that is also very, very important. You can get sued also. Then replacing the clinical gestalt. What is this gestalt? Anybody? Gestalt, GAS. This is a German word. Okay. This is a German word. It's mainly related to gestalt principles. Okay, gestalt principles. इसका मतलब क्या है? See, I am looking at the screen. All the visual input is going to my eyes, then it is going to my gray brain in the occipital area. From there, it is communicated to my temporal cortex, then I am speaking. So all integration is going on. This visual perception is nothing but a gestalt principle. Okay. Same thing happens to the AI model. Okay. Which AI model we use for image analysis? Anybody? Can you put it in the chat box? For image analysis, what is the model? Artificial intelligence, machine learning or deep learning model we use for image analysis? Please type it. It's called CNN. What is CNN? Anybody? It's called convolutional neural. So please go to your previous videos that we have sent, the foundation of AI. What is CNN? What is RNN? What is natural language process? You will be knowing it. So gestalt में क्या होता है? It's a visual perception. Same thing happens to the CNN technology. Once you upload a chest X-ray or a face of a child with abnormal faces, it is going to identify just like our brain. It will see the edges, it will see the patterns, okay, it will see the intensity of the colors. Then depending on the training, it is going to give you the output. So this is a gestalt principle. Okay, so that is, the training is not good, then that model is going to give you a false report. Okay. What is the commonest image model that has been implicated in India? Any idea? It's called Cure.ai. Okay. I think in the next Sunday's class, we are going to tell Cure.ai. This is an image model that has been used extensively in All India Institute of Medical Sciences. Okay. So they are using this model mainly to screen the chest X-ray and CT scan for tuberculosis and pneumonia and various conditions. But they are giving a disclaimer. This is a AI generated report. This is not 100%. It is not used for medical legal purpose. If any abnormality detected through this screening tool, AI tool, we are going to again look at by a experienced radiologist and sonologist, then we are going to report it. That is the disclaimer that the AIMS is giving as per the DPDP Act. Okay. That is the CDSS system that they are using. Then comes the actual demo of today. Till now, any doubts? Any
Okay, sir.
doubts or anything you have
No.
not followed? Nothing. Okay. Now we go to the demonstration of this one de-identified case of Kawasaki disease or a viral exanthema, 3 years old. Okay. So we have a case here. Okay. Kawasaki is mimicking. Anyway, I have a separate this thing. Just I'm going to tell you. We have 3 years old boy, previously healthy, with history of fever of 4 to 5 days, more than 39 degrees centigrade, poor stretcher and poor antipyretic response, okay, for paracetamol. And he has a diffused maculopapular erythematous rashes over the trunk limbs from last 2 days. Bilateral non-exudative conjunctival injection. That means there is no pus is coming out. It's just a redness of bilateral conjunctivitis is there with congestion, all those things. He has a red cracked lips, strawberry tongue, erythema, mild swelling of palms and soles, little bit of cellulitis like signs in the periphery is there. Unilateral cervical lymph nodes of 1.5 to 2 centimeters. And his lab parameters, he has a high raised CRP, ESR. Okay, the inflammatory marks are raised. He has a neutrophilia. He has a thrombocytosis. He has a, in urine examination, there is a sterile pyuria. That means his cultures are, blood and urine cultures are negative. So this is a history. I know most of you can diagnose this is something like a normal viral. It is doesn't not looking like a viral exanthema. But for a common pediatrician, definitely I think something like nowadays we are getting lots of cases of, because monsoon has started, we are getting lot of cases of viral fevers with exanthema. We are getting the streptococcal infections. We are getting dengue-like fevers. We are getting HFMD, hand, mouth, foot diseases. We are getting Coxsackie-like Bornholm diseases that I also suffered 10 days back. So we are getting these types of dilemmas. So you can ask the LLM whenever you are not getting the proper response from the patient. Okay, that is what our main intention. So every feature is consistent with Kawasaki, yet the case is very misread without structuring reason. So that gap, this gap, that is exactly what we are auditing in this model. Okay. So remember, before you putting the cases, you have to take out all the protected information like name, medical registration number, the dates, photo, each and everything, you have to take it out. As you know, as all of you are now very much know about this prompt engineering, you have to tell the role, you have to give the context, you have to tell what format and what purpose you need a differential diagnosis, or you want a American Heart Association, Kawasaki disease mapping next step, management protocols, and of course, safeguards like number of doses, okay, number of invented results, and any flagging, all those safeguards you have to mention it. Okay. So you have to prioritize the problem list, structure the differential diagnosis, all those things you know it. Okay. So we have to run these prompts in these 3 LLMs. Okay. That is ChatGPT, Gemini, and the Claude. Okay. So same prompt, same case with how the behavior changes with the different models. So these are all the three engines, okay, that we take out. Once the class over in this week, whenever you're free, so take these three models, okay, and work with this any cases, whatever you want. Okay. I'm not giving any assignment on this. This will be your assignment for the next week. After the 2 classes, okay, you take these 3 models and you use Kawasaki disease or whichever the cases in your domain. You analyze how these different models will give different output and which model is good in which, okay, which is bad in which. That you have to differentiate. I'm giving you a gist of idea. For example, Claude Opus is a good reasoning model. So does it map Kawasaki disease viral against AHA criteria? That you have to check. Does it flag incomplete Kawasaki disease logic with coronary and echo risk? It's all still deepen reasoning. Ask for IVIG or aspirin dosing. If it refuses, ask for the weight. So these are all the critical thinking you have to put into the model, whether this model is performing well or not. Okay, that is one thing. Take it to the chat GPT, same prompt. Okay, you have to note whether it is committing or hedging behavior. So iska matlab kya hai? Hedging behavior matlab kya hai? It's a cautious or evasive or non-committal language to acknowledge the reason of whatever you are asking. Say for the behavior of the model, whether it is behaving consciously or not, or simply it is giving some unnecessary answers which is not related to your question. That means that model is not performing well. Then you have to ask for the citation according to the American Heart Association criteria for this Kawasaki defeat and check the citation one by one. Then watch for a invented lab or echo result in that if that case it is available or not. This is about ChatGPT. Then comes the Gemini Deep Search. See, in Gemini Deep Search mein kya hota hai? It will retrieve whatever the articles which are there to the deep research, because it's a good research engine. Then it will formulate a synthesis, each and everything. It pulls each and everything about Kawasaki's guidelines. Okay. So in terms of research, to dig the matter into the deep, this is very good, Gemini. And open the link sources and check this synthesis is correct or not. That is our part. And the best for the literature triage. Okay. But it is not the bedside call. Whenever you go home, you put everything into your Gemini research. On spot, it is very, very difficult. But Claude is the one which is combination of these two. That is why most of the good AI-enabled clinician favorite now, as of now, is Claude Opus 4.8. Not all models. Claude Opus 4.8. It's a pro model. Okay. Then comes the score of reasoning. I think this I will skip because I'm going to share these slides. Very, very important. You can go through this and you can make your own score depending on your knowledge, how this AI output behaves. This is just an example from 0 to 5 you can give regarding the problems completeness, differential quality, investigation management, guided alignment. If you are an academician, if you are an examiner, Dr. Minas, just like how you score your students, whether if it is a undergraduate, if you are a postgraduate, whether you are a fellow, you assess this model in the same way. You give the marks. Okay. Then comes the hallucination added. I think
Yes,
you
sir.
have to check factuality. You have to see the, sorry. Anything you wanted to ask? Faithfulness of the model, guidelines misapplication, safety critical tail.
No, sir. No.
Okay. So tag each questionable sentence ABCD and you have to find out what is the level of hallucination in this model. Okay. So you can ask me, Deepak, every time, every case, shall we have to do this? No. Initially, till you are adjusted to with that model, you have to do this. Once you are very well aware that you have a very good confidence with your model, the model will understand you and you will understand the model in both the way. So chances of hallucination will be very, very minimal. But always better you delegate this work to yourself or to your assistants who are very good to recheck the outputs. That is very, very important guardrail I wanted to show you. So you have to score this hallucination risk index between 0 to 3, severity, uncertainty in different. Then you have to calculate this hallucination risk index with the frequency plus severity minus uncertainty. Okay, this is how. So this is I'm going to share you. You can do it. And this is the one more demo I'm going to show you today. That is Glass Health AI. This is from US. Okay, same case we run in the Glass Health, and we will see. Okay, how we are going to analyze it. So we are going to enter all those things. I'm going to tell you step by step. In order to save the time, I'm not going into the detail of this slide. Of course, governance in the close, I think Dr. Krishna Rajbar has given entire 2 hours on this, how we have to govern the models. Okay, this is very, very important. So what is the dosing, treatment instruction, all those things you have to check. And before you giving a discharge summary or anything, you have to go according to the DPDP Act. That is very, very important. So important, the 3 closing rules, what I wanted to tell you is, AI is a very good assistant in giving you the differential diagnosis and differential management protocols. Okay. The clinician is the one, we are going to make a decision, not the AI. In pediatrics, assume adult, it is an adult database model. Always ask in the prompt the more pediatric oriented trained answers. Okay, whatever the minimal it is there, you make use of it. Always de-identify the protected health information. Check the doses. Always check the citations and references and guidelines. Okay, so reasoners reason, retrieval tools research. Okay, clinical tool draft. So all these things you have to keep it in mind. Okay, with this, I'm going to put an end to my contextual theory. Now I will come to the chats. Any doubts? Okay, no doubts. So we go to the chat GPT. So before chat GPT, I will take you to this perplexity, how you can use this perplexity. Okay. All of you can open perplexity in your computer or in your mobile. See, I have asked perplexity, help me to make a complex pediatric case analysis prompts step by step using Gemini, Claude, ChatGPT, how CDSS works in pediatrics. This was my prompt. Okay. For that, what I have choose, I'm taking a new chat. See, any prompt related to clinical diagnostic support system, I'm just typing CDSS. So go to this plus button, go to this connectors, choose academics. Okay. Then go to the search, take deep search. This is a mandatory. Okay, all of you are following? Put a thumbs up in the chat box, please. So choose the academic, choose the deep research. Then give a prompt. Okay. So what is the prompt? I have a 3-year-old child with 4 to 5 days history of fever. I think the voice mode is not taking. I will stop it. So now you know how to choose the academics. Once again, I will show you. Go to the plus button, go to the connector, go to the academics. Okay. Then in the research button, you can choose deep search. Okay. So now I will go to my previous chart to so this was the main thing I have taken. So this is the answer I got. Okay, with the references. And you can ask Perplexity to tell you step by step also. That is also there. I forgot it to tell you. See here, learn step by step. All of you can see here. This also you can choose. So it will going to give you step by step approach to the clinical diagnostics supporting system along with the references and citations. Okay. See, it has given, see the citations it has given. PubMed citation on clinical diagnosis supporting system. Got it? See, it has given step 1, ground students. What is CDSS in pediatrics? What is the definition? What is the role? Okay. This is a step 4. I think I am going to share with this you. So now, which it is asking me which pediatric scenario would you most likely to use first in your AI course to demonstrate CDSS behavior, whether it is a sepsis triage, whether it is an antimicrobial stewardship fever. I never taken all these things. I told, take a case of Kawasaki disease mimicking a viral exanthema. Okay, how to analyze it using various great clinical choice it has given. Okay, it has started giving these things. So constructing pediatric case. Okay, Kawasaki's diseases, demography, lab values, then generic CDSS style prompt in Kawasaki diseases. Okay. So this is the patient data, 3 years old, male child, 14 kgs. Okay. So you just copy this. Okay. Copy this prompt. Now you put it in the chat GPT. So take a new chat. Okay. So this also I will put it in the chat box so that you can also try in your chat GPT and Gemini. You can just copy it so that you can also have that. So you here you have to type the role also because this is just a patient data, anonymous patient data. So I am a pediatrician. So kindly give me CDSS management protocol. Okay. Clinical diagnosis support system managing protocol for this child. Okay. Let's see how this is going to answer. See, this is the ABCD management protocol: airway, breathing, circulation, disability, exposure. What is the diagnostic criteria it is given? This is complete Kawasaki. Differential diagnosis it has. Yes. Can you able to follow me? Yes. So this is a differential diagnosis: measles, scarlet fever, adenovirus, toxic shock, because there is a sterile pyuria, thrombocytosis and all. This supports the Kawasaki's disease. What is the immediate investigation that we have to do? And urgent echocardiography. See, this is very, very important that we expected. Why? All of you know, earlier the diagnosis, the complication. What is the complication of Kawasaki disease? All of you know, it's a coronary artery stenosis. So you will have something like myocardial infarction in a child who suffer from Kawasaki's disease. See, that is also one of the commonest cause of premature myocardial infarction in younger adults. The previous Kawasaki's with this coronary artery stenosis. That is why urgent echo is very, very important. Once you do the echo, early the interventions, especially IVIG therapy, then the results will be benefit. Then additional, if already there is a ischemic signs in your ECG, troponin level, BNP, albumin, all those things. In case now COVID is again coming back again, try for this MISI and COVID analysis. Coming to the risk stratification, inflammatory markers, these are all high inflammatory activity. And what is the treatment protocol? So do not wait for day 5 till the clinical criteria fulfilled. Why? Because to prevent the complications of Kawasaki's disease. And starting the aspirin dose, that is also very, very important. What is the low phase? How to monitor in the children, fever monitoring beyond 36 hours. What if child is not responding? What we should do? We can start with the second dose. I'll start with the methyl prednisolone, pulse methyl prednisolone treatment, or you have to use this infliximab, that is again monoclonal antibodies. Okay, all this. It is easily, it has given as per the protocol. Please unmute. Somebody, there is some voice. Please unmute. So what will be the cardiac evaluation? Repeated 2 weeks, 48 weeks. Okay. How do you assess all these things? Okay. Monitoring during the admissions. So it has given you complete soap notes of Kawasaki's disease. How beautifully it has given. So did you like this ChatGPT Outbook? So I'm going to share this link. Okay. Copy the link. So I'm putting it in the chat box. Any doubt? Okay. Now, what we will do, we will copy the same prompt. Okay. Then we will go to the Claude. Okay. Take a new tab. So in Claude, whenever you are asking for a CDSS, don't take this Sonnet. All of you can see the screen. Take which model you should check? The Opus 5, that is new. Okay. Opus 5, you have to just copy the prompt. And now you hit the button. Same thing you do with the Gemini. Take a new, this one. Here you have to choose the Pro one or thinking model. Okay. Thinking is a good for reasoning and to solve the problem. Pro is mainly for maths and coding. Take this model, hit the button. So I am going to share the 3 outputs from 3 different LLMs, and you should be able to see which are good in which, LLM is good in which. Okay. See, this is the output from the Gemini. It is very fast. would you like to review specific risk stratification scoring models? That is Kobayashi score, you know. Okay. If you tell yes, it is going to give you the Kobayashi scoring system for the institutional guidelines. People who are working in academic institution for study purpose, all those things, this Kobayashi score system will be there. What is atypical? What is okay? See, it has given the criteria depending on the sodium level. Okay. See, ChatGPT never gave this. Have it given this Kobayashi scoring system? Follow? No. See, that is why always you have to try with these three models. Okay. One will be good in one other way, depending on the training that they have done. Okay. So this is a Kobayashi scoring system. And it has given you a variation, a artifact it has given you. Then again it is asking you, would you like the formula of standard reference ranges for calculating exact body surface area coronary Z scores? Like that it is going to ask you. Okay, you have to download it. Once you have to read it and you have to see. Let me see what is the CLAD answer. So this is the CLAD, CDSS also suspected complete Kawasaki's disease. See, each and every word it is implying. Say for example, if you asked me or a new fellow, I would have told it is suspected Kawasaki's. Now, because of lots of training of data, now these reasoning models are given you suspected complete Kawasaki disease. Okay, not incomplete or question mark or something. What is the diagnostic verdict? 5x5 principal criteria. Each and everything it is giving detail. Immediate workup, what you should do. What is the normal baseline echo? Okay. What is the definitive treatment? All these things. Echo follow-up schedule. Counseling and discharge. And bottom line for tonight, admit, baseline echo labs, IVIG, these are the things you should do. So this supporting against American Heart Association 2017 guidelines and IAP guidelines. See, this is one what you expect as a clinician. Okay. And you can ask for the reference also. Okay. And you can ask for the follow-up question also. So let me share the link for your purpose. Just copy it and paste it in your browser, or this is the cloud output. Where is the Gemini here? Okay. Share conversation. Any doubt till now? All of you are following? Yes or no? I'm not listening anything.
Yes, sir. Yes, sir. Following. Following,
Okay.
following, sir. Try to following.
Any doubts? You
We
have?
need to practice on it.
Yes, yes. That is why open it and practice. Don't worry. Okay.
Yeah, we are doing.
You do it slowly. See, unless you don't do it, you will never learn it. Okay. See, now you have three outputs. Okay. Huh? You have to compare each and everything because we are all beginners. You have to go each and everything. And tomorrow in the WhatsApp group, let me know how you people compare this model in your way. Okay, you may be correct, you may be wrong, don't worry. Okay. Otherwise, you share this all your outputs to your known very good professor or whomever you want to assess your outputs, and you take whether ChatGPT output is good, whether Claude is good, whether the Gemini is good, let me know. Okay. And depending on that, you have to score the rate the output of the LLM, rate the hallucination index. Okay, I will share the slides to you, and you are the one who are going to decide how this really the clinical decision supporting system is going to work. So I just recapitulate you one by one what we have learned. Okay, open the perplexity initially. Okay, any case, complicated case, you just make a prompt. Okay, you can type it. Always go to the academic search here. You have to have a pro version of perplexity. Go to the academic version. If you want to make a structured this thing, go learn step by step you take. Otherwise, straight away go to the deep research. There are two options are there. Then this is going to give you the step by step approach to your complex problem. Then chat with this what cases you want. It is going to give you the proper prompts that you have to type. Copy those prompts, put it into these three LLMs like Gemini, Claude, and ChatGPT. Okay, initially at least you try 4 to 5 complex cases. Then whichever the model which suits you best, you believe that. Okay, that is my take-home message to you. Okay. Then we come to the Glass Health AI. So this is the Glass Health AI. Okay. Otherwise, you can just type glass.health also you can type it. This is one of the clinically intelligent electronic medical record, okay, which is developed in US. Okay, you have to log in through your Gmail account. Okay, it is asking I am a clinician. Okay, Smart Hill Nexus, that is my email account that I have given. See, this is the home page you get. So this is a clinical intelligent search engine, okay, for latest medical evidence. Okay. So you can choose the models also here. You can choose auto model. You can choose ChatGPT 5.5. You can choose Opus 4.8. If you give auto, what happens? The Glass AI will go through both ChatGPT and Claude, and it will analyze which is the best for Glass Health AI. But if you are very comfortable with ChatGPT, you can go with the ChatGPT. Okay. Or if you are good with Opus, you can go with Opus. Okay. Only thing you should, this is a paid model and very costly model. Why I'm showing to you is you should have a idea that how our EMR should be EMR should be there whenever a vendor comes to you like Eka Care, HealthRay, or the Vatsala.ai, the new pediatrician I told, no? When they come to you, these are the things you are going to see. This feature should be there that you should know as a AI-enabled pediatrician. That is the purpose of showing this software. You will have a little bit of credit. You can use it for 1, 2, 3 times. Again, you stop it, open a new Gmail account. Again, you use it with that account. Okay. You can try as many as you time. So this is the home page. Okay. Clinical intelligent. You can choose your specialty in this. You can click here. Since we are all pediatrician, you can click. Okay. For this time, you can tell. Okay, pediatrics. See here, you can ask a question. Okay, like this. A clinical case in general. Or you can straight away ask a differential diagnosis. Okay. Straight away ask with your lab result, you can ask a straight away discussion. Draft assessment and protocol notes. Okay. These are all various part of this EMR. You can draft a clinical note who has got admitted in your hospital or who are coming with follow-up for your clinic regularly. You can just draft the follow-up notes or clinical notes. You can draft this health history of presenting illness. Okay, you can draft in a proper way. Okay, These are all varieties that I am showing you. Then comes the draft pediatrics. Again, history and presenting illness. Okay. Management protocols you can draft in pediatrics. What else you can do? You can draft the progress notes. If it is a chronic case which is admitted in your NICU or ICU, you can draft a progress notes of that case. See, these are all the aspects. You can draft the well child note, consult note. What is this AVS? AVS ka matlab after visit summary. Okay. That also you can give. See, these are all the various things you can do it with this discharge summary. You can do it. Okay. Task list you can do it. You can give a draft to the patient's handoff. Okay. Suppose you have a images. If you have a lab result, you can add a context to that also. Okay. Now we will really experience this case. Okay. So eyeglass, I am an experienced pediatrician. So I have to click on the start scribing here. Hello, Glass Health. I am an experienced pediatrician. I have a 5-year-old child, male child, who comes with history of 4 to 5 days of high fever with the chills and rigors, not responding to the acetaminophen or paracetamol regular dose. And he also has erythematous maculopapular rashes all over his body. He has a unilateral cervical lymphadenopathy. He has a bilateral conjunctival non-suppurative injections. And also he is complaining of body pain, body ache. On examination, he was a very toxic child having 105 fever, Fahrenheit fever, and he has a tachycardia. So, give me the diagnosis and management protocol. Okay. See, this is the thing I have asked. So, this is the summary that I have asked. So, once you ask this, you draft a discharge summary. Sorry, differential diagnosis with this. See? It has given you the differential diagnosis. With the references. See, this is the dream CDSS you wanted to expect. Yes or no? Did you like?
Yes, sir. Yes, yes, sir.
I have not typed anything. So, this is a integrated and validated discharge summary. With the references, you can see it has given the level of citation, high impact, high cited. What is the guidelines? This is how the ideal AI-enabled electronic medical record should be there. Okay. Now, you draft assessment and protocol, you tell CDSS. So, would you like me to draft assessment and plan next? Yes. Okay. You click and you want accurate, submit it. This is a response. Now, it is going to give you assessment and protocol plan for this. So, it is asking the feedback. Okay. Again, references. With the references, it is giving you. Okay. Then what else you want to do? Draft a progress notes. Okay. So it is going to draft to the progress notes. See, it takes little time. Okay, probably these are from the cloud, what I believe. Okay. Because with the references it is giving means it is with the cloud. So I request all of you to go to this glass.health. Okay. Use it for 4-5 cases. You have to try it out by yourself. Okay. Any doubts?
Can you please repeat in short how to use? We have already on the.
Yeah. I will come back.
We have logged in for the glass, but not been able to do what you have done. Yeah, because we
What it
have
is
come in the
asking?
glass.
You can share your screen,
Okay,
sir.
this
I
is
will
the
stop
this is
sharing. Can you able
no
to
I
share?
am no not okay. Yeah, this is the one we have. From here we can go about.
Yeah. Now you choose here pediatrics. You click on the general, scroll down.
Okay.
This time
Okay.
you can. Okay.
Okay.
Now you click on this voice button. Tell start scribing button. You click. Okay.
Okay.
Hello, Glass. I am senior pediatrician. I have a case of severe high degree fever child of 10 years old, female child. She came with joint swelling, multiple major joint swelling of knee, elbow, ankle with 10 days history of fever. And early morning, she used to have more joints pain. She has developed little bit of subtle erythematic rashes all over the body. She has taken some anti-inflammatory medicine, which is giving a temporary relief. Tell me how to progress about this case. What could be the differential diagnosis and management? So now you
Okay.
stop. Okay.
Sir.
Okay. See, this is the case you have taken. This is this one. You can recheck it. Okay. Then in the left, in the middle box, you can ask for the differential diagnosis in this case.
Understood.
You have a chart just like in Notebook LM, na?
Sir.
You got it?
Sir, got it.
Yeah. Any doubts?
So that
This is
means
the
you have to
differential
continue chatting.
diagnosis. Yeah.
So that means you have to continue chatting on this meet box.
Yeah, that is better, na? See,
Understood.
once you buy this software, no, it costs around $80 per month. I'm just going to this thing, workspace.
There are three things: $20 for starter, $90 for pro,
yeah.
and $20. Yeah. Yeah.
See, these are all these things. This is $90 a month. Okay. But don't get it. Huh?
Yeah, very expensive.
Open 2-3 emails, Gmail account, and you can use it. Huh? See,
Okay.
this is the idea that I have given you because I am not recommending any single EMR provider.
Okay.
It is,
But how do you feel, sir? This is very good enough from Glass Health?
This is supposed to be my Bible, like for because I have seen lot of newer and newer softwares. Na?
Okay.
If you are in US, no, you can connect with the EMRs of US. Like
Okay.
Athena is the one, eClinical works. It will be get integrated.
Understood.
See, tomorrow, central government is make each and everybody to mandatory to use a clinical software, which is ABDM enabled. ABDM का मतलब क्या है? आयुष्मान भारत digital machine.
Okay. Okay. Understood.
So you have any software which is you have to ask whether your software is ABDM enabled. Okay.
Okay.
These are the question you have to go into ask it. Second question is whether it is a cloud based or offline. Most of the ABDM are cloud based. Okay. And regarding the features, you just go through glass.ai and see the features, make a note of it. Okay. You should tell the vendor, these are the features I needed.
Mhm.
In the next class, in the Sunday, I think I'm going to deal with you how to choose a good electronic medical record. Okay, I will tell you. After that, these demo vendors will come. I will give 15 to 20 minutes each to them. They are going to showcase their software. Okay,
Understood.
so you can take a trial version for 1 month. You can use it in your hospital. Okay, then you can ask them to customize in your way. Say, for example, if Dr. Prabhakar is there, he is good in respiratory. I need a very good respiratory specific domain knowledge AI enabled software with RAG base, which is based on the GINA guidelines of asthma, NTP guidelines of tuberculosis. You got it, Minas?
Got it. Yes, sir.
So hallucination
Yes,
rate
sir.
will be very, very less.
Sir.
Dr. Pradeep Sihare has a multi-speciality pediatric hospital. He needs a very good intensive care enabled all this ICSSM, that is Indian Society of Critical Medicine, protocols enabled, IAP intensive care protocols enabled, rack system software. You have to tell him.
So,
One
so
last
how?
thing. Yeah.
Yeah, I just want to ask me, okay, how this this software will help me in managing the ICU cases.
Sir, whenever you have a complex cases in ICU, where you are in a dilemma, it will
Yeah.
act you like an intelligent, experienced professor. It will give you
Okay.
choices. Say, for example, whole night you are not slept because of heavy duty, you are burnt out. That time your thinking level will be not normal. You'll be exhausted. The amount of reprehending your previous knowledge will be difficult because of cognitive overload. That time you can use this complex AI. You can just scroll through the differential diagnosis and protocols it has given. Whatever you find it is good, you can take it as a positive one.
Will it give the differential diagnosis and protocols also?
That is what I showed you, na?
Yeah.
That is
So
what I
this
showed you.
our software will give.
See,
Our software will give.
the next Sunday, they are going
Yeah.
to give you demo. Okay.
Okay.
They will tell you, see, we have a agentic software. It will go to Chat GPT. It will go to the cloud. Okay. It will go to
Okay.
the Gemini and it will take this thing. Got it?
Okay.
These agents,
Actually, that I
these
was thinking
agents
that,
will do not have their own knowledge. They will make the prompt and they will go to the appropriate large language model and they will pull the data. You got it?
okay.
That is
Actually, I
what.
was thinking that it is only the record keeping softwares.
No. We are coming out above that.
Okay.
That is all traditional AI, Dr. Pradeep
Hmm.
sir. We are, along with the traditional AI, we are thinking AI like doctors. That AI is going to help you. That AI is going to help parents. We have gone into such an extent, Dr. Pradeep sir, in the
Yeah.
intelligent system. You please, all of you, I request you to go through that video that I have sent you. Again, I will put it in the Perceptron group. 2 hours 32
Okay.
minutes my talk starts. In that time in the YouTube, you listen to me for 1 hour how the intelligent system works. But before patient comes to see you, you will know most of the patients why they are coming to you,
Okay.
because you have a software. Such a software, they will just log on through your phone WhatsApp and they are going to tell Dr. Pradeep sir, mera bachcha ko kitna itna tha. It will tell you need to come urgent to the hospital, take an emergency. It will give you the emergency slot also automatically. That's a pre-visit AI. Then the reception will see you that this is an emergency case. She immediately give you the appointment and they will come inside to your. And by the time you will be knowing in your computer that this is a case of this is the thing. There is a red flag sense of sepsis or high fever or whatever it is. You are going to tell them and you are using your intelligent software which are there in your computer. It is going to flag you. This is a Kawasaki. This is a measles. This is a dengue. Then you are taking action.
Okay.
Once the patient is in your ward, you are going to see the progress notes. Then you are giving a discharge summary as per the DPDP Act using a AI. Okay. After checking, then the patient is going to discharge. See how this intelligence is, how we are using before the visit, during the visit, after the visit. Now you got it?
Yes.
And what you do in your clinic is CDSS. That is today's talk. Hope I think all of you got my today's this thing. Of course, for somebody it is a very difficult thing. I think any questions, Dr. Prabhakar?
Yeah,
Yeah.
I know you've been using Axon software for
Yeah.
several years now. I've also been doing that. So, are you planning to change over to a more AI-enabled system,
Yes,
or
yes,
you want to
yes.
integrate things?
I want to. Because
Okay,
this is a very basic traditional software Axon I am using.
correct.
Okay. Whatever the data I'm getting, I'm converting into Excel format. Okay. I don't want to lose this old patient's data. Now I am telling my vendors, 2-3 vendors, to integrate my old data to migrate it to the newer software. Give me, these are the things I want. Probably Dr. Bhavin Soni will come on the Sunday or the next week. He is going to show his pre-visit AI, during the clinical visit AI, post-visit AI, and rapid AI. Rapid AI का मतलब रात को 2 बजे बच्चे को कुछ प्रॉब्लम होगा, they are going to ask in the WhatsApp to the AI that is going to connect to the duty doctor of your hospital. He is going to instruct and the patient is going to come emergency. That means
Yeah,
24
I
into
actually saw
7
that part. I actually
Yeah.
saw that part live on that day on this.
Very good. So I request all of you, these are the concept, but it has to be validated, Dr. Prabhakar sir.
Yeah.
So that is why after this month got over, all of you involved in this project, take the demo version of the software. You need not have to pay. We have to validate because we are all the expert pediatrician, because we are all experienced. We are the one, we give feedback to this AI people. This is a tech team. Not only doctor pediatrician is there. I think 7 to 8 teams were there. Okay. I think Sunday you are going to meet all those them. They have done a lot of wonderful job to create a first Indian AI-based pediatric software. Okay. I think it takes time. It is in an infant still stage. I'm not guarantee that it will give you 100% result, but it can give you around 60 to 80% result because we are the one, we are training it. So our academy is not only coaching you, we are making you to act like a researcher. We are making you to act like a validation. That is, role is there. Okay. If software comes out very well, I think Dr. Bhavin is very kind enough to give you a co-authorship to present in whenever the conference you want. You will be a part of the conference in that. Okay. I think with this, so please take down all the links you have. Ria, anything you wanted to ask? If you do not have paid version, does it affect the search? Definitely, Ria. Are you there?
Yes, sir.
See, as a pediatrician, let us not be so stingy to not spend money. Okay, at least $10 to $20 per month. You have to spend out either for the cloud. See, because we are all doing since last 3.5 years, I always prefer cloud. Okay, and a basic version, 400 rupees version of ChatGPT. Anyway, if you have a Geo SIM, you have a Gemini Pro is there. These 3 are enough. Don't spend more money.
Okay, sir.
Got it. Take the Cloud Pro version because it always give you a AI conscious report, Ria. Okay. Why I want ChatGPT 400 rupees Go version? For images, for infographic. I think Dr. Lakshmi, I think from previous batch asked me, how should I do infographic with my photo, with my bio? I should do infographic. Then I told in notebook it is not possible. You go ChatGPT, tell ChatGPT upload your photo with your credential. Tell that on which topic you want to make infographic. Along with your photo, it is going to do a good infographic. In that, ChatGPT is good. Okay.
Okay, sir.
So always don't ask from now onwards whether I should take a paid version and all. That Indian mentality have to come out. You be global, Dr. Ria. Okay.
Okay, sir.
Whenever you buy a car, just let me complete. Now, with the good experience, you go for a safe car rather than a good mileage car like Maruti. You want to get a good car which is comfortable, which is very speed, and also if something happens, all the airbags should open, and safety is very, very important. That is why you go for a complete full version of a reputed car like BMW, Mercedes-Benz. That is why they are costly. Same way in AI models also, you should have a very good pro version, because each pro version will give you the deepest answer that your prompt you are given, always with a citation, and hallucination rate will be very less, and it is always updated regularly. That is very, very important. Okay. Hope, I think, Ria, I answered your question. Yes, sir. Dr. Minas? Any questions? Somebody was asking now?
Sir, the only thing is that I go beyond. Yeah, I go beyond. I go beyond what Dr. Ria is telling. Like, most of us will agree that we have the basic version. Say, for example, most of us have probably
No, your voice is dragging, Dr.
and
You can
in
switch off
fact,
your video.
when you have to have the more space in the Google, most of have Google Gemini also paid version. May not be very high end, but at least 500 GB or 1 TB most of us have, because there is a problem. Oh my goodness, I know what is happening. Okay. Yeah, that's what. So, the problem is we want to learn you from, the basic that we have. Lord, GPT, so for example, class AI looks very good. But $20 per month, the $90 per month is too high.
So don't take that $90 month. That's what I told you. That is for demonstration. I showed you. Okay. Demonstration, I showed you that glass health. I never recommend. Even I don't have that $90 pro version. Got it? Dr. Minaj voice is too dragging and it is vibrating. Anyway, there is some issues with his internet. Any other questions, Dr. Sucheta?
Sir, you mean to say that we should take Claude Pro as well as ChatGPT Pro? Is that what you
No.
mean?
ChatGPT Go. Go. I will show you. I will show you that. See, ChatGPT. Where is it? Yeah. See here?
Yeah. So for routine purposes, Claude Pro and
See, this
ChatGPT
one.
Go.
Go. 400 rupees. Don't take this. This is again costly. Okay. If you are doing lot of images and all, no, then you should take this. Huh?
Okay. So Claude Pro and ChatGPT Go. Huh?
Yeah,
That's it.
ChatGPT Go and Google Gemini Pro. That is for Geo, it is free. GeoC.
And if we are doing a lot of research work, then
Then you
Perplexity.
take Perplexity. Okay. Perplexity
Thank
Pro
you.
you take. Earlier Airtel it was free. Now it is $20 again. $17. But don't take this Perplexity computer. This is 16,000 rupees. Huh? Expensive.
Yeah.
And I use Perplexity free with this assistant. This comment server. You can see here.
Yeah.
This is nothing but Perplexity only. Okay. See here.
This
This
Perplexity
comment it is giving, just like Google server. See, you have a Google browser. See here. You can see Google, na?
Yeah.
This is a Google. I never use this. All of you use, most of them, Google. I use this Perplexity comment. Okay. I think in the foundation class, Dr. Avnish shared, Perplexity comment.
So Perplexity
So
Academic is the regular one. Or it's a different one.
You have to go to the pro version here. See here.
Yeah.
You have to go to connectors. Here it is there. Okay.
Okay.
You can
Thank you,
choose
sir.
it. Okay. Then here, if you want to learn step by step for the student like, you can take this. Otherwise, go to deep search. Okay. Right?
Deep search is part of Perplexity Pro.
Yeah.
You have to pay extra for this.
This is the one which is costly, computer. This is
Okay.
a agentic AI. This costs around 16,000 rupees per month. But it does lot of job, but I am not using this. Okay, it is not. Any doubt?
So in one particular month, if you have a lot of research work to be done, you can take 1 month subscription then for computer and then get the work done and get out of it. Can we do that?
Dr. Rakesh, I think we have a separate 4-hour session for research.
Okay.
That myself and Dr. Yaqub from Pakistan, we both are, we are going to take you in depth into that.
Okay.
We have very other good tools apart from Perplexity. Perplexity is just a 5% of it. Okay, that we are going to show you. Don't worry.
Okay. So thank you, sir.
Welcome, welcome. Anything? Any other? Dr. Josni? Male Jora, Kundapura? Yes. Hopefully this class was fruitful to you. Please go through the recordings. Tomorrow I'm going to send the recordings. If any doubts and all in the next class, please write it down or put it in your WhatsApp number. In the WhatsApp, I think I'm going to answer it whenever it is. Thank you very much for your patience. Again, it is almost touching 11 o'clock. Anyway, time is not the matter. It is how much that I have given you the knowledge that matters a lot to me. Okay. I think
Yes,
with
sir.
this, we'll make it a day. Happy Guru Vandana for all of you. We are all both mutual gurus. We have to learn a lot of things from you. And without you, I can't learn anything. So I always thank all of you for being my gurus. And let us make this AI knowledge progress throughout the world at an affordable cost. Okay, that is my main intention. I don't want to compete with others and all. Okay, with this, we'll make it a day. Good night. Have a good sleep. Do some 5 to 6 minutes of box breathing with your relaxation music. My kind request, humble request to you. Okay, we'll again meet you on Sunday. Again, I will come back with a lot of demos. Please don't miss. Okay, thank you very much. Good night. Bye. Bye.
Thank you, sir. Good night.
Good night. Good night.
Good night.